Okay, so let's talk about some of the different medications that we're going to use. Let's set up a table here for all the medications that are going to help us lessen the burden on the heart. Okay, for one, we're going to work on vasoconstriction. It's a long word, vasoconstriction. And two, we're going to decrease not just fluid retention. Well, yes, we're going to say it decreases fluid retention. That's the best way to talk about this. So fluid retention, because decreasing fluid retention is going to have an effect not only on the force in the circulatory system, in the vessels of the circulatory system, but on the workload that we send back to the heart. Okay, so let's just draw ourselves a little line here. Okay, so let's start by talking about an ACE inhibitor. Okay, so these are really popular. You've probably heard them discussed either around the house or in the news. They're very common. What they do is they inhibit the action of this enzyme here. So if we're inhibiting the ACE enzyme here, we're not producing angiotensin 2 and by extension aldosterone, which means that we are going to decrease vasoconstriction and we are going to decrease fluid retention. Right, so that's a pretty straightforward mechanism. So next we are going to talk about These words are all so long, so thank you for bearing with me. Angiotensin 2 receptor blocker. So this is exactly what it sounds like. It's a nice informative name. So angiotensin 2 is sometimes produced even if we have an ACE inhibitor in the blood. So what we can try and do is stop angiotensin 2 from binding to its receptor so that the changes that it's trying to bring about are not going to happen. You're not going to get vasoconstriction and you're not going to get the promotion of aldosterone. Right? So angiotensin 2 receptor blockers are going to both decrease vasoconstriction and decrease fluid retention by stopping angiotensin 2 from binding to its receptor. Okay, next we want to talk about an aldosterone. So now we're moving down the chain here. Aldosterone antagonist. So an antagonist is kind of cool. It binds to the receptor that the normal molecule is supposed to bind to, so in this case aldosterone, but when it does so, it doesn't enact the changes that the normal molecule, aldosterone, would enact. So it's basically just like a dummy molecule that gets in the way and binds to that site, so it keeps aldosterone from binding, but it doesn't cause any changes. Right? So if we have an aldosterone antagonist in the blood, we're going to be able to minimize vasoconstriction, right? And we're going to be able to decrease fluid retention, which is going to help all around the board. So the next thing I want to talk about works on a little bit different of a mechanism. Okay, it's called a beta blocker. This is a very important, very common medication that's used to treat high blood pressure, to control blood pressure. So a beta receptor is on smooth muscle tissues, often in the arteries but also in the airways, right? And it binds adrenaline or epinephrine, and when it does so, it causes that smooth muscle to constrict, right? So it promotes vasoconstriction. So if we can block that beta receptor, right, if we can antagonize the adrenaline, right, then we can help minimize vasoconstriction, right? So minimize vasoconstriction. Now beta blockers have also been said to minimize renin. They inhibit renin in some ways, but the main purpose here of a beta blocker is to help control vasoconstriction, at least in our conversation about how we want to reduce pressure. Okay. So the next thing we want to talk about is what's called B-type natriuretic peptide. So this can be synthetic, but it also is produced naturally by the body, and it is produced when the heart senses that it's being overstretched, right? When it's got too much blood in one of the ventricles or the atrium. So it produces this peptide in order to increase the amount of fluid that the body releases. So the way it works is it encourages the kidneys to take up solutes. When the kidneys take up solutes, water follows, right, and promotes urination. So you're releasing fluid through urination, which effectively is going to decrease the force, and it's also going to decrease the workload, right, because we're going to have less fluid in the circulatory system, right? So the big thing with B-type natriuretic hormone is fluid retention, all right? And the last thing we want to talk about are diuretics. Diuretics. Okay, so these are medications that decrease fluid retention. Okay, and they work in a variety of different ways, so we won't go into the different mechanisms. There's so many different mechanisms that explain diuretics. So just understand that they promote the release of fluid through urination. So they're going to get that fluid going through the kidneys and out of the body. So those are the big categories of medications that lessen burden on the heart. Okay, so let's talk about some other ways that we can assist the heart. So one way is to increase contractility. All right, so we say increase contractility. All right, and so basically that means we are going to make the heart pump harder. Increase contractility. Another really long word. Okay, so to increase contractility means that we're going to cause the heart to pump harder. Okay, and that's good. If the heart's not working so well, it might be beneficial to cause that heart, that ventricle, to pump harder so it can get more blood out into circulation. So one common medication is called Digoxin, Digoxin, and it's basically going to work because it's going to increase the amount of calcium that remains in the muscle tissue in the heart. You need calcium in order to cause the muscle to contract. So by keeping that calcium in there, it's going to enable the heart to contract more vigorously. It's going to increase contractility. So that's one category and one example of medications that increase contractility. Alright, so the last category of medications that we sort of need to talk about, just because we're talking about medications that are involved with heart failure, are anticoagulants. So during heart failure, you can get points where the blood just gets backed up and it's not moving as fast as it should be moving, which can promote the formation of blood clots. Blood clots can travel into other places in the body and cause serious problems. They can inhibit blood flow, so generally we really don't want clots to form. So anticoagulants are often given in order to minimize the formation of blood clots.